So we'd just like to say, first of all, welcome. My name is Sonja Courtis, and I class myself as an emotional wellbeing specialist, working with people with anxiety and depression and other emotional issues that might be coming up. And I am here tonight with two very talented and clever women to talk to you, well, to interview actually them on the process of how your birth, whether you've been born or whether you are a mother or a father or someone who has, parented a child, on just how significant the impact of the birth experiences is. So I'm going to first of all introduce our two co-hosts, and they will talk about themselves a little bit, and then I've got some questions to ask Sharon, and we're just going to go straight in and get into the nitty-gritty. So my intention for you, for any of you who have jumped on, is that you're going to walk away from this event in the next hour with some really big insights into just how important this topic is when looking at your well-being potentially. So first of all, I'm going to start with you, Gaylene. So hello and welcome all the way from Nelson, New Zealand. Just tell us a little bit about yourself and what you do.
Okay. Well, hello everyone. So my name's Gaylene Hansen, and I work as a registered nurse, and I am trained also as a midwife, though I don't work as one now. I work in a special care baby unit as a nurse, and I have been there for quite a number of years. About 6 years ago, I started looking at a wider picture, and I got very fascinated in and trained in something called meta health, which is our mind, our body, and our brain, social connection, and our body's innate wisdom. And then within that, I started learning EFT and learned more of the EFT, and went on to matrix reimprinting, matrix birth reimprinting. And I continue to work alongside my neonatal work and work with clients on a range of health concerns, symptoms, traumatic events in their life, including birth experiences. And more recently, I've been working with trauma-associated epilepsy, which has also captured my attention. But my biggest passion is enabling newborn babies and families to feel safe and nurtured. It's my greatest passion area.
A very good area to be in as well. So thank you for that. And we'll be getting some questions later on in this webinar. So over to you, Sharon, all the way from the United Kingdom. Thank you so much for being here. We really appreciate your time.
You're very welcome, and I am so happy to be here. Yay! Well, my name's Sharon King. I'm the creator of the matrix birth reimprinting technique, or whatever. I teach matrix reimprinting and matrix birth reimprinting to practitioners, but I'm also author of my book here, Heal Your Birth, Heal Your Life, which I know, Sonja, you've done a wonderful job at promoting for me, and Gaylene too, so thank you very much. And I specialise, I guess, in helping people to heal from birth traumas, or to transform their experience of birth even, whether it's your own birth, being born, or whether it's a mother giving birth to a child. And of course the fathers are included in that too, because they also get traumatized, as does the baby, as does mum. And I also work with pregnant women to help them achieve natural births as well. And there's a lot of information in my book about why birth goes wrong, and I know we're going to be talking about that today as well. So yeah, so that's just me really.
Perfect. Awesome. So, of course, I thought I'd start out with, and I've written some questions down because I thought I'm not going to remember them. But the first off the bat, and we talk about birth trauma, and I think it will probably be a good starting point to just explain what we mean by birth trauma. What would you say is the definition of that, so that people understand? Because when I ask that question of people, they say, oh no, I've had no trauma. So I think we need to break that down a little bit, and then I'll ask some questions, sort of go into that a little bit deeper.
So trauma is any time that we feel like our life is under threat. So it can be something like that is a big trauma, like, I don't know, being born with the cord around the neck and not being able to breathe and have to be resuscitated. That's what would be a really big trauma for somebody. But also, as Carl Dawson very beautifully teaches on matrix reimprinting, is that there's a little t trauma as well. And to the outside world, that may not seem like a trauma, but to you, it's a big event. So I'll give the example of Carl's own daughter. When she was being born, Carl was told that his wife was going to be giving birth to a boy. As his daughter comes out, he is so fixed on having a boy that when he looks at his daughter, he goes, "Oh my God, she's deformed." And then the midwife says, "No, silly, it's a girl." And it's like, "Oh gosh, yes, of course." But in that moment, the baby is registering that her father is disapproving of who she is, because she's not what he expected her to be. Now that's a little t trauma, which is an event where we create a negative belief about ourselves in a moment. So nobody in the room would have registered that as a trauma for the baby, but it showed up later on in his daughter's life when she was trying to, where she got upset because some work she'd handed in at school, had been given back, and she didn't get the mark that she wanted, and it re-triggered that I'm doing it wrong. I'm wrong.
Ah, okay.
So so it can be little tiny things that nobody even notices, but to the baby is a big thing, because that's a survival event. If you're not being accepted by the person who's going to be taking care of you, then that's a life and death situation.
Right. So thank you for clarifying that. And so you would say then, so that leads us into what we want to be talking about today, and the fact that I think there's an assumption generally amongst parents and us as individuals and children that we are not conscious until we can start to remember events. And so, I would just want to ask you the question: how you've already touched on it already, but how conscious are we, and how do we know? How do we know that we're conscious? This is something that is so new to most of us. So how would you define that, or, give us an example of how we know that we're picking up on what's going on around us? And when do we start picking up on what's going around us?
Okay, one big question there.
Yeah.
So there is, we don't have what we know as conscious memories. Okay, yet actually, rewind that. If you talk to your 3-year-old child, your 3-year-old child will probably be able to verbalize in some way what their birth experience was like. I'm seeing more and more posting on Facebook recently about women who are saying, "Oh, my 3-year-old child's telling me about the birth experience," and I've got examples of that in my book, and I'm sure you ladies have that example too. But although we lose the conscious memory of everything that happens, but there is consciousness, and there's a slight difference. Everything in that consciousness starts right at conception. So how we're conceived also goes into the mixing pot on our belief systems about ourselves and how we relate and feel in the world. Any experience, mum finding out she's pregnant can be either a really great experience, a positive experience for the child, or a negative experience for the child, because the baby is receiving information from mum through various different ways. All her thoughts, feelings, emotions are transmitted to the baby. She can't stop that. There is no way you can stop that. However you're feeling, the baby is receiving that. So that consciousness continues throughout pregnancy, and continues, through the birth, the bonding experience, the positive experience of bonding, the negative experience of bonding, and goes all the way through until, we start becoming more and more conscious as we get to the age of 2, 3, 4, 5, and then we start having conscious memories. But every experience is recorded deep down in our subconscious, and that's how I describe it. It creates the foundation of who we are.
Right.
Yeah.
Okay. And so then, when you say creates the foundation of who we are, does that mean? Can you give us an example, or some examples of where that might play out in the life of a child or a baby, or even as us as we get older? So if we were to have an experience, say at the moment of conception, that would then lead us to, how could that play out potentially in a person's life?
So if a baby is conceived to a mum and dad who is intentionally creating a baby, that baby's really wanted, mum's feeling the love and the support of her partner, and they're having what I would call a very conscious conception, then as long as the baby then goes on to have an okay birth experience too, that baby is going to grow into a child that's going to find new beginnings really easy. So this will be your child that you either take to the play group or you take it to the first day at school, and it's going to go, yay, let's go and, new adventure, let's go and find some new mates to play with and be very confident and feel safe in the world and find new beginnings really easy, as opposed to the child that maybe wasn't conceived in consciousness and in a conscious way. Mum's then shocked to find out that she's pregnant. Maybe she considers a termination or adoption, and she has to work through how this is going to affect her life. Then you add on, some traumas that happen in mum while she's pregnant, and then a traumatic birth. Now that's going to be your child that's going to be clinging to mum's leg, going, I don't want to go in there, I'm really afraid.
Yeah.
So it's that difference between whether we feel safe in the world or we feel unsafe in the world. The world's a safe place or the world's a dangerous place.
Okay. And so then what if you were, say, conceived unexpectedly and there was the shock of that, but then you went on to say mum comes to a place of acceptance and then the baby is, the birth is, and we're going to go into some more detail in a second, what intervention is and the impact of that, but the baby's born as calmly as possible. Can that reverse that initial conception response of I'm not?
It would be less so.
Yeah.
The more traumas that we have in our life, if you look at the ACE study, the adverse childhood experiences, I've actually done my own version of this where we go back into babyhood. But if you look at the ACE studies, the more trauma that you've experienced in your life, in your early childhood, because the ACE studies done from early childhood, the more negative experiences, traumatic experience you've had, the more likely you are to suffer from depression, addiction, overweight, suicidal tendencies. So it's the same really for the baby. If mum's just a little bit shocked and then decides, okay, I can live with this is going to be a great experience. Now, if I'm working with somebody and that's happened, then we sit down and we talk to the baby. We tell the baby that this is not a personal, it's not about you as a personality, it's not personal, but this is just how it's impacting mum's life. And this is very much how we work in the Matrix anyway. But it's also can be a little bit tricky, because some people will be absolutely fine and have no effect with that whatsoever, but other people will be more sensitive to that. So it depends on their beliefs that they make in that moment, and it also depends on mum's belief system as well.
Okay, so there's the two, because obviously too, and I don't know about you, Gaylene, but I know with working with people, it's almost impossible now to have a client come in where there wasn't something happening in the womb that didn't affect them. And even if it was just mum back in the 70s, it's her first child and she's a bit nervous and anxious about having her first child, and that over time just can leave an imprint on that child that they can go through their whole life, and it really doesn't have much of an effect until they get triggered in adulthood. And then we see that then having to go back into the birth, because that's where it all started. And so that leads, so that's the first, I think.
An example.
Yeah, give me an example. Yeah, perfect.
Well, for me, me personally, when I did my Matrix training and my Matrix training, one word, there was a list of words up on the board and we had to pick one. Well, my word was rejection. And when we worked with it, in 20 minutes, the one word took me straight back into my 8-week-old fetus. Now, I always felt that I was loved during my childhood and things, but that one word triggered me straight back there. And I was 8 weeks. My parents planned 3 children. I'm number 4. I had always felt through my life, well, I bet the system. And but that one word was enough to trigger me there. And in 20 minutes, when we worked through that, my eyes turned the most sparkling blue in 20 minutes, when it was a surprise for my mum. That was what it was when we brought her in. It was a surprise.
Yeah.
And recently, when I did the matrix with our matrix reimprinting birth training, I went back to my dad, and there was an equal surprise there. And yeah, and that feeling, it just went, but my eyes just went amazing blue. The person taking it said, look at her eyes, and they were sparkling blue in that 20 minutes.
Yeah.
Powerful.
So shows a shift in there. Thank you for sharing that. So, okay, so now we can see that even, and we know this too, and I'll just add this because I know that this will be replayed to a lot of people in Christchurch. And the reason this is happening for us is because the research has been done here in Christchurch of babies who were in utero at the time of earthquakes, whether it be September or February. And the psychologist at Canterbury University, and I'm sorry, but I don't remember her name, has got this concrete evidence to prove that those children who are now in their second year of primary school are demonstrating, for many, high levels of anxiety as if they were alive and witness to the earthquakes, like other people who were. And all that is showing that impact of mum's energy and mum's being scared and being triggered during the earthquakes is just, and I'll just add, and I think you'll agree with me both, we're not trying to trigger people here into, oh my God, what have I done to my child? Fortunately, you've got 3 women sitting here with you that can help you with that. But the more awareness we have, the more people can start to be really conscious of what's happening when they are in utero stage. Because I think for so long we've thought, oh, it doesn't matter. But everyone knows that when you play certain music to a child and then you play that music to them when they're born, the child responds to that music. So it's just, okay, so we've sort of identified the in utero impact. So now the big one, which you two are very heavily involved in, is obviously birth experiences. And Sharon, what would you say about the impact of the birth process on a child or a few persons, not just the child, but on a mother's? Let's talk about the mother first. Shall we talk about the mother's experience and what they can do for her, and then also about the child and the impact of a birth experience on us as individuals?
Again, this is a very big subject. So for mum's experience of birth can be a really positive experience, or it can be a really negative experience. And again, it can be something very, very small that happens to her that triggers her. So birth professionals, people like Gaylene when she was a midwife, midwives, I think, are the most magical people in the world, but quite often they are unaware of what it takes in helping mum to feel safe, and they don't even recognize or realize that actually there's something that's happened, or something that's been said, or something that's done that's triggered mum into fear. So as soon as mum goes into fear, the birth either slows down, the labor slows down, or it stops. Okay, and then we then start piling on the medication to speed things up again. And as soon as you start adding in medication to the mix, that actually stops the body from producing its own natural oxytocin and all the birthing hormones that it needs, and it very often will lead down to C-section. But there's so many women I've worked with, one of the biggest aspects is that powerlessness, and also their intuition is telling them one thing, yet they're being told by somebody else in authority that this is not the way it is. So for instance, they want to get up and move around because their body's telling them to move around, and they can't because they're on a drip, because they've got medication going in, or they've got a baby monitor on their tummy. So women can still have a natural birth experience but still feel disempowered in that moment, because it could just be something, again, the very small T traumas, but the very big T traumas as well, being rushed off down to the emergency operating theatre to have a C-section. I've worked with women who have had C-sections and their epidural hasn't worked, So, you know, they felt everything that's been going on, and then they're in absolute terror when they get pregnant again and they don't want to give birth again. And of course their husbands have witnessed that as well. And, you know, so it's massive for women. And also, you know, I want to add in there, you know, it's a very vulnerable time. Okay, so in an ideal world, birth needs to be done and created in the same environment as you do when you conceive the baby. So somewhere dark, secluded, safe, warm, loving environment is what is going to promote a really healthy natural birth. And it's like doing meditation. You know, you go inwards. The mother needs to just focus on going inwards and working with the baby to birth the baby. Now, if anybody's ever done meditation and you've got people wandering around and your phone's ringing and people are coming and going from the room, you cannot focus on meditating. So it's exactly the same for the birth process. You know, it's a very primal action, and we need to go back into feeling safe. And as I said, as soon as we don't feel safe, then things don't go the way that they're you know, nature's planned it.
Yeah.
All the wrong hormones get released, the adrenaline gets released, and then you know, that blocks out the pain receptors, and then, you know, and then it all just doesn't go very well.
Yeah. And so I was just thinking about that, because I know talking to a lot of mothers now, and we see this sort of pattern of being, and this is quite a touchy and can be a sensitive topic, but obviously women are having children older, there's a lot more stress, and we know from our training that if the mother's stressed leading up to the time of the due date of the birth, that in itself, could you explain to us what the impact that could have on a child in terms of coming onto the world and its due date and things like that, or its due time?
Yeah, absolutely. If the mother's been given a due date, then a lot of women are becoming more consciously aware of when they conceive. So the doctor gives them a due date and it doesn't match up with their idea on when they're due, so that creates a conflict. So it can start as early as being given your due date. If you're one of these people that has to achieve something on a certain time, that can put, you know, if that's your programming, then that's going to have an effect. But it also, if the due date is wrong and mum is like 10 days overdue according to the doctors, then they start piling that pressure on to say, well, you know, you need to be induced. And, you know, in every single, I mean, I really feel for mothers in every single way. There's a lot of pressure to achieve. The minute you walk into hospital, you're now on the hospital timeline, time scale, time pressure. You're no longer on the let's just let things evolve naturally. So, you know, it's called the road to medical intervention, basically. And it can be, you know, you can be triggered by having a scan, by somebody saying, you know, oh, there's something not quite right on the scan here. And that can set up fear, and that will go throughout the pregnancy. So there's so many contributing factors. But I just want to add in here as well, one of the things that we usually, you know, the sayings that I have is, we were doing the best we can with the knowledge and understanding we had at the time. So I think this is a good point to put that out to people who are listening, who are mothers, who have gone through this experience. You were doing the best you could with the knowledge and understanding you had at the time. And the great thing about the technique that we're all using is that we can go back and we can heal this experience. We can release the emotions around it. We can also go back, and once we've healed all the trauma around it, we can recreate how it should have been.
Yeah, and I'll vouch for that. And yeah,
that not only has an effect on us, but it also has all the mother, but it has an effect on the child too.
100% it does. Yeah. So with regards to that, so I think there's also the you know, because sometimes we're very fortunate that we do have the support and the medical understanding to be able to, you know, do C-sections of babies under pressure, etc. But can you give us some examples of, say, potential beliefs or perceptions that might come from for a child who does go through that process where they are induced, or they don't come naturally, and then there's induction? You know, what have you seen in your work in terms of belief systems that might, or behaviours that might come up in a child that goes through that process? Because I think that's an important one for mothers to see, maybe when they're looking at the behaviour of their children.
Okay, so for induction, babies are the one who actually start the labour. Okay, generally the baby will excrete some hormones that will start the labour, and also the baby, if left unmedicated, or mum's left unmedicated, the baby can control the speed of the labour too by releasing those hormones. So if you think about yourself in that situation, if you were that baby and you get to choose, you get to start your own labour, you get to choose the pace of your labour, and you're working together with mum, that's a very safe, and you're in control of what's happening. So now imagine that you're a baby that mum's just been induced. So all of a sudden, the labour is starting around you and you've got no control over that. So as a child, you may have a 2-year-old that you'll be pushing her and saying, look, come on, hurry up, we're late, we've got to get your older brother to school, hurry up, come out, you know, get your coat on, get your shoes on, we're late. You're going to be pressing that unconscious trigger. And I love what Gaylene shared about her story, you know, when she was 8 weeks in utero, is that you're re-triggering that experience of being rushed out of her first home, if you like, that she had no control, she had no say, she couldn't even control the speed of how things were happening, because now mum is putting all this pressure and force on her. So she's going to go into a tantrum. She doesn't know how else to express this other than you know, because we're out of control, and we all know what that feels like, to be out of control. It's not a nice feeling. So that's just one little example. You know, what I always ask people to do is put yourself in the baby situation. How would you feel? And, you know, belief systems around being born by C-section can vary depending on the circumstances around it. Again, if it's an elective C-section, babies are going to have a different belief than they are if they're an emergency C-section.
Yeah.
So an elective C-section, nothing even gets started. Once again, all of a sudden, baby's just hanging out, doing its own thing. The next minute, sunroof's open, out baby gets pulled, got no, like, whoa, I'm powerless. And this shows itself as, I need somebody to pull me out of the situation. They can't even start a project because they feel like they need somebody else to pull them out of that situation. So if a baby is emergency C-section and they start the labour and then they get stuck, again, then that adds in the I'm trapped. So elective C-sections don't have the trapped thing, but the the emergency C-sections do. So you add in on top of that, I'm trapped. So that almost intensifies that feeling. So you go to start a project and you may be able to start something, but then you start feeling, the minute you start getting a little bit stuck with what you're doing, then that will be re-triggered, and then you'll just have to go, oh my God, I just need somebody to pull me out of this. I need somebody to help me, and I'm feeling pretty bad about this situation right now. So, and we have no clue that it goes back to our birth experience. No. You know, even people with fear of flying, you know,
I've had that
because we're in that.
Birth, yes.
Yeah, stuck in the birth canal. We have no control because somebody else is driving the plane.
I've had that with a client recently, Sharon, where a client had the cord around her neck, and it was all, her anxiety was all around in here. She could just used to feel it in here, and then it went back to her birth. But could I just add to that, when we were on our training, and Gaylene was there as well, I remember you talking about elective and emergency C-sections, and I'd been out to dinner that night with friends of mine who had 2 children. Now, the first was their daughter, and she had an emergency C-section, and the second, the son, was elective. She went on a certain date. They knew it was coming. She was very calm. And they were talking about their 2 children, and they said, he is just this go-getter. He's got no fear. He just takes everything and goes for it, climbs walls. He's just fearless. And he was the one born by elective C-section, whereas the daughter's very tentative, very afraid, needs a little nudge. You know, she's not willing to take positive risks. And they told me that night at dinner, and then the next day you covered that in training, and I rang them and I told them this, and she just said, it couldn't have explained her 2 children more succinctly than that. So that is really an important thing.
The positive effect about being born by elective C-section is like 1 minute you're inside, the next minute you're out. So the baby learns to assimilate information really quickly.
Right.
So I'm not advocating elective C-sections, but it does mean that you can take on information really, really quickly.
Yeah. Okay, and because that's the thing, our next thing I really want to talk about in a bit of detail, and I think this is where Gaylene will get involved a bit too. So we've obviously covered, you know, in utero experiences, and then we haven't talked too much about birth interventions other than C-section, but, you know, I know that with forceps and suction and people just kind of, you know, say, oh yeah, they were suctioned out, and there's no sort of, if that's almost seen as normal for some, but could, you know, even in that term, I mean, that you would say that that's a birth trauma as well, because it's anything that goes against that natural sort of birthing experience where the mother and the child are working very succinctly together. So the next thing is, just as we're coming into birth, the immediately after birth experience. And this is a big one. I know Gaylene's really passionate about this. And I'll get you to talk to it briefly, Sharon, and then I'm going to hand it over to Gaylene to talk about what she's learnt and is discovering now with her experience in her care postnatal. Oh, well, it's neonatal, isn't it? So, Sharon, what would you just want to share with what you know about that aspect of the birth process?
What what happens straight after?
Yeah.
Okay.
Yeah.
So one of the biggest and most common areas that we work with matrix birth reimprinting is that period of separation. Okay, so I speak about my own personal experience where my mum was given pethidine, and when I was born, my mum was very, very sleepy because of the drug. So we stopped down to a nursery, put in a nursery for 5 or 6 hours while my mum slept off the effects of the pethidine. So I missed the first 45 minutes of the crucial bonding time because my mum was sleeping. And as a baby, to be separated from your mum for that big period of time is actually a life-threatening situation, because the bonding process is so important to our relation to the world, our physical build up. You know, there's Dr. William Emerson is an American doctor, and if you go in to his surgery at the age of 45, he'll tell you exactly how your birth experiences was just by the list of your physical conditions. Because a lot of our physical body, our brain function, our immune system, our nervous system, our digestive system is all affected by birth, but also those first initial hours of being born. So it's absolutely crucial, if at all possible, that the baby is put onto mum's chest and is with mum. Even, you know, babies who are not doing very well, I appreciate that, you know, sometimes we really do need that medical intervention to save that baby's life, but to be with mum and those medical interventions done while baby's on mum. And I know, Gaylene, I'm not going to go too much into skin to skin. This is your passion, but you know, that separation from mum is often unnecessary and is extremely damaging to the baby. So
Okay. All right.
to the
So I'm
baby's perceptions of the world.
Now I'm going to hand over to you, Gaylene. I'm disappearing for 2 seconds to let a dog out to go to the toilet that I'm looking after. So take it away, Gaylene, because this is your area of expertise. Talk about the importance of it, how that affects development, what you know about that skin to skin, and the research that's been done and that you're aware of. And I'll be back in a sec.
Okay. So as Sharon mentioned, that 45 minutes after a baby's born, there's so much extensive research done on this now that it's such a window of opportunity. Babies are normally really alert, unless they've got a drug or something on board, they're normally really alert. Think about your first home is in the uterus, and your second home is if you are lifted, especially if you were lifted up by your mum as you've been born and you come out and you're lifted, it empowers her, still attached with your cord, gently loving transition there, straight on skin to skin on your mother's chest. It's driven by smell. The baby smells mum. They're totally reliant on smell. It's a very, very old sense of ours, and they recognize and they need their mum's smell. And that area, just how nature's done this, the area around the nipple to a baby smells like amniotic fluid. So if you've got one home in utero and now they're on this home where they can transition gently and they get to feel mum. There's always sensing, babies as we are as well, but they're sensing, am I safe or am I unsafe? And if my mother is not right here, I am not safe. Baby may go to sleep. We see this with babies, sometimes they'll go off to sleep, where sometimes they're trying to get an attention and they will disassociate. They may go quiet, but sometimes, a lot of the time, it's disassociation. So at birth, when they sense, they smell, they're on their mum, they're feeling her. You watch the baby when it's born, they're kneading, they're feeling the sensing with their hands on their mother, that touch and her warmth. They see mum, and that's a huge, deep connection. Their eyes are normally open and they are imprinting on their mother. They taste breast milk, and that sets off a whole lot of change in the microbiome that's in the gut. It's activated. It sets them for life. And they're hearing mum's voice. They already know it. They know mum's voice. They know dad's voice already. They know what they've already heard and experienced in utero. It's familiar and it's safe. And when we add the warmth of mum and the breast milk in their tummy, it regulates the baby's heartbeat. They're right on mum. They're sensing the heartbeat. So skin to skin, it wires and it fires all these really good feel-good hormones and receptors in the brain and for mum and baby, and putting them on dad as well. You know, half an hour, 30 minutes on dad, not straight away. Well, if mum is not mum's had a cesarean section, a baby's premature, then if you can get that baby on dad at least, preferably mum first. 30 minutes on dad wires his dopamine levels for his life. That's a connection with his child. This is research. Niels Bergman has done so much research on this. So it's setting this foundation, and it's wiring and firing the social and the emotional intelligence centers, this area of our brain here. And the amygdala area, it's where we're processing all our emotions. It's starting with something that's such a strong foundation. It's where through our mum, we learn empathy. Those first 1,000 minutes and the first 1,000 days are really critical periods. So wherever you can, put babies on skin to skin, newborn babies. Allow the mum to lift them there preferably. Leave them there. Mum and dad, turn the lights down a bit. Quietly observe, not leaving them. Just keep an eye to make sure everything's safe, especially with like a premature baby or a baby that needed some sort of resuscitation. Respect this precious time. Enable it, don't interrupt it. Again, as Sharon mentioned, unless there's a life-saving measure that far outweighs having the baby there. And preferably this is at the time of birth, but something that we'll be looking at as part of our matrix birth reimprinting. If you didn't have it then, if you couldn't have it then, or you know that you didn't get that, I know personally that I was separated from my mum after she was born. It was just what was done in those days. And I've been back in that, and I am back on skin to skin. And so was every other baby in that nursery that I was in as too, because I've got them back on skin to skin with got their daddies to go and get them, to take them back. And that's my imprinting again now. It's, you know that we can go back. With matrix birth reimprinting, we have tools, the way of addressing and healing this, and it's a very much an integral part of our matrix birth reimprinting process.
Awesome. I appreciate you sharing that with us, and you can just tell your passion, Gaylene, and I, having trained with you at the Gold Coast, but I for me as a, dare I say, a person who's not a mother, I sense that and understand that. And, when I work with clients now, and you will all vouch for this because we all do matrix birth reimprinting, it's so fascinating when I take a person to their birth experience, and you know, when we look at those beliefs and we find out that they, you know, struggle to form loving relationships, or they feel detached, and then you discover that they would take it, or they don't have trust is a big one I find comes up. There's that lacking in trust. And then you find out that at birth they were separated from mum. Sometimes it might have only been for 5 minutes, a minute, but that's enough for a child to make it mean something. And I think everything that we're talking about here, and I think I would love to just emphasize this, it's perception. It's like, it's what in that moment, at that time, for that 30 seconds, 1 minute, 5 minutes, 10 minutes, it's what you made it mean at that time. If we could all look back at our past and go, oh, don't worry about it, it's all good, we dealt with it now, well, then we'd all be amazing. We'd all be walking around feeling fabulous. And yet we can reverse that. That's the other thing. Thank goodness.
Within New Zealand, there's putting babies skin to skin where I work, and I think throughout a lot of the other areas in New Zealand, this putting the baby onto mum, or allowing the baby to be on mum, is enhanced as much as possible.
Right.
It is very important for midwives, people that I work with. Yeah. It is very important. And for premature babies as well. We get them back on skin to skin wherever possible. Yeah. It's important.
So also I think another one that's really important, and when I see movies or videos of babies being born, and something that's not touched on a lot, but is the clamping of the cord, because we now know a lot more about the impact of that. Would either of you like to comment on that one? Because that's one that, it's always been baby out, clamp, clean it up, get it on, you know, not so much anymore the cleaning up part, but where are we at now, and what's the importance of keeping that cord attached post-birth? And what's the ideal time frame? Is there an ideal time frame? Who wants to answer that one? Gaylene?
Can I answer that one?
Yes.
Okay. So the optimum time for nature's such a wonderful thing. Nature's designed it to give us the best chance in life. And when a baby's born, they're born less 30% of the blood supply that they need to be whole. So that extra 30% gets channeled through the placenta to the baby for about 15 to 20 minutes after birth. And what that blood carries is all the oxygen the baby needs, the stem cells, everything to help set up the immune system. But also you think about the lungs. The lungs are starting to inflate and to open, and they've got little blood capillaries going through them. So it needs the extra blood supply that it wouldn't normally have if you cut the cord straight away. So if you cut the cord straight away, then the baby's body is going to have to struggle then to make up that extra blood supply, more blood is needed in order to be able to function. We got to make some more blood supply. So it's putting extra demand on a physical level, it puts more demand on there. On an energetic level, it also has a massive impact as well, because if you look at lotus birth, and lotus birth is all about keeping the placenta, everything intact until the placenta actually dries up and disconnects of its own accord, and that can take 3 or 4 days. Now, having interviewed Ravishana, who's written the book about lotus birth, she talks about how there's a consciousness transmission, if you like. So the placenta and the afterbirth has a consciousness, like every organ in our body has its own consciousness. And it's that gentle transmission of the consciousness that comes through. So even if you just leave that cord connected for that first 20-25 minutes, that means that some of that energetic consciousness is coming through. And I know that may be a little bit woo-woo for some people, but you know, she actually says, you know, if that's allowed to happen, then babies are a lot more present, they're a lot more conscious, they're a lot more aware of what's going on in their world. So it's like everything we do has a consequence, and if we can keep it as natural as possible, the leaving the cord connected, the breastfeeding, the skin to skin contact, the dim lights, everything that Gaylene's just spoken about, then it's just creating that safe place for that baby, and you're having a physical, emotional and mental experience for that baby. That's safe.
Yeah.
It's recognised that even for small premature babies, that to enable the cord to stay pulsing for a bit longer now, it's and they're very much trying to do it even with some quite small premature babies.
Yeah.
Because it's recognised. So, well, this is in New Zealand anyway. That's the area that I know. And I know that midwives have a passion. We have a lot of independent midwives in New Zealand who do home and hospital births. And they're, again, and like the core midwives, are pretty passionate about skin to skin. And it's even part in the Well Child book in New Zealand. Did they have an hour on skin to skin? Did they breastfeed in that first hour? So it's recognised. Yeah, which is good.
Beautiful.
And
I'm really excited that actually next year I'm going to start my program for teaching midwives, EFT, matrix reimprinting, matrix birth reimprinting. So the independent midwives, the English ones, are now going to have this as part of their training. So yeah, it's happening. It's happening that these beautiful angels that help babies come into the world are going to be even more aware of how they can help their mothers. So I think that's amazing. But I'm glad it's happening in New Zealand. You guys are quite rare. Yeah.
So, because in terms of, I know, and this is where I think it's really hard for a parent, is that, how do we empower women? Because there's this perception at the moment that the medical profession know everything and whatever they instruct us to do is what we need to do. And interestingly enough, that powerlessness that you speak about can then play out for the mother in terms of, I don't know if you know anything about this, Sharon, but the link between this powerlessness, the birth experience, postnatal depression and anxiety, is there a link? About current,
I know a lot about that.
Yeah, so maybe you could talk about that as well. I think it's really important to look at how this is impacting mothers, because it's undeniable that we have a very high number of women with struggling now post birth of their children. So
absolutely. So I have worked with a lot of women with postnatal depression, either while they have postnatal depression or years later because that they suffered afterwards. There is do you remember I said at the beginning of the interview that there is like the more trauma that somebody's experienced early life, the more likely they are going to experience trauma later on. So the ACE study shows us that adverse childhood experience. So I have never yet worked with a lady who has postnatal depression that hasn't had these two things happen in her life, and maybe three. The first one is early childhood trauma. If you add into that, let's just say three, her own traumatic birth experience and lack of bonding experience, and then add to that her traumatic time giving birth to her child, then that is the perfect storm or perfect recipe for postnatal depression. I've not yet worked with somebody who's had great birth and bonding experience for themselves, small amount of trauma. Nobody ever goes through life without trauma. We need trauma to make us resilient, but no big major traumas and a positive birth experience. I've never yet met a woman, and please tell me if I'm wrong here, but I've never yet met a woman who has had postnatal depression after those positive experience. So can you see how I say about that foundation, that early 9 foundation? With people who get PTSD, will have had a lot of ACEs and babyhood ACEs in their life because they're now exhibiting that as PTSD.
Yeah.
So,
that makes complete sense. So then I guess we could start looking at what can we do about this? Because this is obviously something that's very prevalent, and there could be some people who watch this later on and go, well, what do I do about this now? What are my options? What would you suggest?
Well, with matrix reimprinting, EFT, matrix reimprinting, matrix birth reimprinting, you can actually work on how you're feeling in the moment. So you have a number of options. Work on how you're feeling in the moment. The tapping, the energy psychology technique is tapping on the meridian system in order to start shifting the stuck energy that you're feeling, the stuck emotions. Use matrix reimprinting to go back into either your utero experience, conception in utero, birth, early childhood traumas. go back and clear those using that. And then with matrix birth reimprinting, you go back and clear all the traumas around your birth, and then go back and do the birth and the bonding how it should have been. Now, we have what's called mirror neurons in our brain. Okay, now our brain does not know the difference between what's physically happening in reality or what's imagined. So I was just watching Greg Braden and Joe Dispenza talking about this last night, where he is saying you can actually watch a football match or a sports match on television, and your brain will be firing and wiring and releasing the same sort of adrenaline that as if you're playing that game. Yeah, so it's the same thing when we go back through the birth experience, and I'm actually going to get scientific evidence of this because I've now found a way of doing it, is to actually, when we take people back through that bonding experience, that birth experience, how it should have been, and the bonding, where we can see what's going on in the brain, where we can see the prefrontal cortex, the cingulate gyrus in the emotional brain, the heart connection, where we can see all of that happening for the mother while she's going back through bonding with her baby, or for the baby or your client at the time that they go back bonding and healing their own birth experience with their own mother. So and those mirror neurons in the brain will be releasing the oxytocin and all of those really great safe feelings. I mean, people in the room when we're doing demonstrations of matrix birth reimprinting can feel the energy of what's happening with the demo person. When we're working with clients, our mirror neurons are firing and wiring with theirs, and we're also going through that birth and bonding experience with them, and we're getting those feel good hormones too. So that's why we just love what we do, because we get to feel good too. So so from that level, and it just creates so much healing. There are so many stories that I can give you where, I've worked with a client, they've gone back through the birth experience of their of their child, and their child has had physical changes, emotional changes, mental changes, whether, I don't know, there's just too many case studies right now.
I can vouch for that, yeah. And Gaylene as well, yeah.
Yeah. But it's something that everybody can do. We now have this power, and you mentioned earlier about how do we empower women to have a positive birth experience. If I can just answer that too, is by clearing past trauma. So if I work with a pregnant woman, I'd like to clear her own birth experience, clear her beliefs around herself. I can't do this, or I'm not going to be a good enough mother, or I have this fear of giving birth. Working on all of that, whatever's going on in her life right now. And then I do what we call a future birth reimprinting, where we go into the future and we show the baby how it's going to be. And again, that's that wiring of an experience. And so far, touch wood, 100% success rate of women who have done all of that clearing have gone on to have a natural birth experience. So it's all about helping them feel empowered in a moment where they could potentially feel disempowered. And another real passion of mine, as we were talking about the midwives, is everybody, I believe everybody in that birthing room should have cleared their birth experience. Midwives are constantly, they bring their own birth traumas to the experience, because a lot of midwives go into being midwives because of their experience of birth. So if we help the midwife clear her birth experience, if we help the midwives or empower them to help each other, more importantly, this is why I'm so passionate about teaching midwives, because then they can work with each other and they can help each other. Birth sometimes goes tragically wrong, and that is a massive trauma for anybody who's in that room, who's experiencing that. It's a massive trauma for the family, but it's also massive trauma for the birth professionals who are there too. So keeping them processing their trauma, it's like ambulance men, it's like policemen, it's like firemen, at some point they get such a buildup of trauma from the things that they've experienced that it has some effect on them. So in an ideal world, everybody in that birthing room should have cleared their own birth experience and knows what it takes to empower a positive birth experience.
Thank you so much for that. Whew, it's a lot to take in. But we're getting there, and it's just we're crusaders, the three of us, as well as many other women trained in this process. Now, we've got some cool news to share, Sharon, that you might want to tell about some future endeavours that are occurring here in New Zealand. That my intention is to get this video out to hundreds of people between now and the next few months. So please tell us what is up for us here in New Zealand in regards to the work you do.
Well, exciting. The three amigos, as I'm now going to call us, Sonja, Gaylene and myself, in October, are looking to put together some talks, but also more importantly, some workshops for birth professionals. Again, education for birth professionals, and opening them up to helping them open up even more to the concept of what they can do. But also for parents who've experienced, you were talking about the earthquake that happened in Christchurch, you know, it doesn't just have to be that, but parents that are experiencing problems with their children, whether that be anxiety or whether you're recognizing and hearing some of the stuff we're talking about and recognize that in your own child's behavior, just want to explore that. Whether you want to get pregnant and you want to learn more about this, then we're going to be doing some talks, I believe, in Nelson and Christchurch. Yeah.
Yes.
To you know, and there's three of us, so we can, you know, bring more of this information to you, but also help start to introduce you. And even if we have time, my passion would be to take you all through a healing journey too. So that's my goal.
So I just have to watch this space. I mean, I'd like to do another one of these too, you know, live, and get more people on live. But we now have this recording available, so that Gaylene and I will be going gun-ho to share this and get this out to as many people as we possibly can, because this is literally life-changing. So in the meantime, if you do want to get in touch with any of us to ask questions or connect with us, you have Gaylene Hansen. Now, Gaylene's based in Nelson, and her company or her business is Nurturing Naturally New Zealand. Is that right? I do it the right way around?
Nurturing. So it's, Nurturing Naturally NZ. So it's www.nurturingnaturally.nz is my website.
Okay, awesome. And you can look up your name as well. And I'm Sonja Courtis, and you can find me in Christchurch, but I also work online. And Sharon, whose book I recommend for anyone who's ever been born, because it is a phenomenal resource that will just, it's called Heal Your Birth, Heal Your Life. I've posted it 1,000 times on my Facebook, I'm sure. It's not that many, but Sharon King, what can I say? Gaylene, do you want to close off with anything?
I just like to say Sharon's book has also just been translated into German, hasn't it?
Yes. It has, yes. And soon to be Bulgaria, South Korea, and hopefully Spanish too. So
Spanish is the big one.
Yes.
Yeah. Fabulous.
Yeah.
And Sharon, what can we say? Thank you so much for your knowledge and your experience, your time. You are one of Earth's angels, because the work you're doing is so important for so many people. So thank you so much for being with us. We really appreciate it.
You're very, 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 very welcome.
And from me, thank you very much. And that's so funny, because my mother's videos just come on and I didn't do that. So apparently I had a calm birth. So wow, look, love to you all, and to anyone who's watched this video, is continuing or watching it at a later date. Thank you so much. Like we said, come get in contact with us. You don't need to do this alone. There is help out there, and as Sharon always says, it's never too late to have a happy childhood.
Absolutely. And if you're watching this a little bit in the future, then magicalnewbeginnings.com is my website, which will hopefully have details of the workshop we'll be doing in New Zealand, and there's lots of other information on there too. So.
Fabulous. Awesome.
Thank you.
All right. Thank you. Thank you.